The coronavirus is spreading like wildfire in Arizona. That is what the Arizona Congressman Greg Stanton tweeted Sunday. The state is setting new records for hospitalizations, as is Texas. Hospitalizations also rising in Florida, recording its highest day of cases ever over the weekend after opening its beaches recently.
But we definitely do want to sound the alarm. We are seeing an uptick, particularly in the age demographic 18 to 35. And particularly after Memorial Day weekend.
21 states have seen an increase in new cases as some experts link the rise in new cases to the lifting of state lockdown orders. Our CBN medical reporter LORIE Johnson is here now with a look at how the coronavirus situation is developing in the United States. Now, some observers believe the reason we're seeing an increase in new cases is because there's more testing. Others say it's because we're now getting out and about. What are your thoughts?
Well, unfortunately, Ephraim, there's a lot of misinformation out there. It's true, there are some rises in cases in some states, but overall, nationwide, the number of cases is down. More importantly, the number of deaths is way down. Thank God for that. Yesterday, 345 deaths nationwide. That's the lowest number of deaths since we've seen in March, about 3 months ago. So yes, we see in the Northeast where there was that horrible outbreak earlier, those numbers are dramatically down. We're seeing about 20 other states, aside from New York and New Jersey, down. But yes, as you pointed out, Florida, Arizona, North and South Carolina, some of these other states, the numbers are up. But as you again pointed out, it's when we talk about the number of cases being up, that's not nearly as important as the hospitalizations because there's increased testing. Yeah. We're doing 100 times more testing now. And all the experts told us that when we test more, we are going to find more positive cases. Now, it is true that of the people being tested, there's a greater percentage of people testing positive. But as I said, we really want to look at those hospitalizations because that's where the crux of the matter is. And we are seeing hospitalizations up in some places, but not to the point where the hospital systems are overwhelmed. And that was our initial concern, was overwhelming. This is not happening. We're seeing it getting a little bit too close for comfort in some places, but we certainly aren't seeing any shortages of ventilators, which was, again, one of our primary concerns about hospitalizations. We have so many ventilators, we're actually giving them to other countries who don't have enough.
Okay. Now, we are about 4 days away from summer, and there was talk of hot weather slowing down the virus. Is that likely? It
is true, and this is what we see with the flu, because studies have been done, and we know with the coronavirus specifically that a hot weather, ultraviolet radiation, so we're talking about temperatures over 80 degrees, and in the sunlight, that does kill the virus. But Ephraim, what the weather is outside doesn't matter what's going on in here. So if you're inside, it's still cold and not very humid, so it's still very transmissible inside, and let's face it, most of us are inside all summer long, especially when it gets really hot.
Yes, avoiding the heat. There's a new study out about the effectiveness of masks. What can you tell us about that?
Masks work. We already knew this, but this has been confirmed. New study shows that masks are really one of the best ways to prevent this virus from transmitting. So folks do need to wear their masks. It prevents the virus from coming out of our mouths and hitting other people, especially if you can't social distance. That's the best thing also, but a lot of times people can't social distance, so wear the mask. It works, and it usually protects the other person, not yourself, so it has to be compliance all the way around. And some good news, when you were talking about the weather and wearing masks, we've already seen some early numbers from the protests, and in Minnesota, it doesn't look like there was a jump in cases, perhaps because it was outside in the heat and in the humidity. We did see some people wearing masks. And also, though, Ephraim, a lot of those protesters, from what I saw, were young and healthy, didn't have those comorbidities like obesity, diabetes, which goes along with obesity. Just being over the age of 70 is a comorbidity. If you have a comorbidity, you're 6 times more likely to be hospitalized.
Yeah, only a few seconds left, but I have to ask this. The FDA says it's not going to authorize emergency use of hydroxychloroquine or chloroquine for the coronavirus. coronavirus. Is that a surprise?
Well, it could be political in nature. Remember, there's a presidential election in about 4.5 months. This was the president's drug. He liked it so much. So doctors can still prescribe it. The new research showed that it does cause heart problems for some people and does not appear to work on people who have COVID-19. The jury is still out about whether it protects against it. And also doctors can still prescribe it off-label because it is being used for people with malaria, lupus, and rheumatoid arthritis.
All right, thank you.